If you have a baby in your life, it's likely that you'll have to deal with a diaper rash at some point. Diaper rash is the most common skin condition in young children.
In babies, they have two things going against them. Number one, they have very sensitive skin. And number two, they're sitting in a wet, dirty diaper all day long. So the interaction of those two things causes breakdown in the skin, which leads to a diaper rash. And once the skin area is irritated, it starts to get worse and worse and worse until you intervene.
There are two main types of diaper rash. The first is a contact diaper rash. This presents as red, inflamed skin. The second is a yeast diaper rash. This rash looks similar, but has red satellite lesions that spread out from the center of the area down the thighs or up the back. There are a number of remedies available.
Number one cure for a diaper rash does not involve wipes or diapers or creams. It doesn't involve any antifungals. The number one way to fix a diaper rash is to air out the diaper area. So oftentimes I'll tell the mom to kick back, watch some TV, put the baby on her belly with the baby's tush in the air and the diaper underneath, and let the air just dry everything out. And let the baby rest on you for an hour, 2 hours, several times a day. And that's the number one way to get rid of a diaper rash.
The most common age for diaper rash is between the ages of 9 and 12 months. Why? Because that's usually when babies start sleeping for longer stretches of time, which means less diaper checks. If possible, you should check the diaper area every hour and change the diaper immediately if it's soiled.
First off, I always tell parents that it's always a good idea to do frequent diaper changes. Frequent diaper changes will allow the moisture and the dirt to be removed and to allow the skin to start healing again. Second of all, you could use a diaper cream. There are many diaper creams available over the counter. There are diaper creams that are clear ointments like A&D or Aquaphor or Vaseline. Then there are other ones that are white, and those white ones contain zinc. And zinc serves as a terrific barrier between the wetness of the diaper and the skin. And that allows the skin some protection in order to allow the healing to begin.
If you're dealing with a fungal diaper rash, there are some antifungal creams that are available over the counter. Even topical antifungals that aren't necessarily meant for diaper rash can be a good place to start.
And oftentimes will do the trick. On other occasions when it's not really working so well, the over-the-counter versions, we have some prescription creams like nystatin that we will often use. In a very bad diaper rash, sometimes I will also include a steroid cream to start healing it out.
Some children are naturally prone to diaper rash, while others are resilient, or they may be sensitive to whichever diaper you're using at the moment.
Now, today, there are two different categories of diapers that I see. There are the typical Pampers, Huggies, Costco brand diapers that you couldn't buy. They're white and they have their shiny Velcro strips that you could put on. And then now there's the dye-free, unscented, unbleached types. And those tend to be a little bit more brown. Sometimes I'll turn to those because they don't have some of the chemicals, irritants, that the typical white diapers have. So if a child tends to have lots of different diaper rashes over the course of several months, I'll say, why don't we try a different diaper?
Wipes can also be a problem. Wiping already irritated skin can make the rash worse. Commercial wipes will often have perfumes and soaps in them that can irritate the skin.
What you could do is rinse it under warm water and rinse out all the soap and all the perfume in it, and then you could use it to clean the diaper area. And oftentimes when it is irritated, don't wipe, pat it dry, pat it clean. And if it's really bad, sometimes I say take the baby, especially with a small baby, and take the baby's tush and put it right underneath the faucet and just clean it right underneath the faucet with no wipes at all. And oftentimes doing that for a few days works.
You may have noticed that we haven't covered baby powder or talcum powder yet. That's because it's no longer the go-to remedy that it once was.
Baby powder works to keep the area dry. However, we do not use baby powder anymore on diapers. The reason is a baby is changed multiple times a day. And the typical motion is you take the baby powder and you shake it, put it onto the diaper area, and all of that baby powder gets into the air and the baby inhales it. And we don't want baby powder in the baby's lungs. So baby powder is a thing of the past in regard to taking care of diapers.
Most diaper rashes clear up in 24 to 48 hours, but if your child has a diaper rash that doesn't improve or worsens in 5 days, call your pediatrician. I'm Dr. Mike Rosen, and you're watching the eHealth Network. Stay healthy.